What happened to you?
I was in a car accident.
Sucks.
We were rear-ended on my side, and I got whiplash.
Yes. So what were your symptoms before you came in?
Oh, I couldn't turn my neck. My neck was tense, and I was just in a lot of pain down into my wrist, and I had a lot of, when I was trying to work, it was hurting.
Yeah, in your wrist.
Mm-hmm.
And were you getting numbness or tingling?
Tingling in this side of my arm.
Okay. So that's important to know because there's a chart over there, and when someone says, I'm tingling right here, it kind of tells us exactly what nerve it is.
What's bothering you, yeah.
Well, I'll tell you exactly in the spine where it's coming from. So how are you doing now compared?
A lot better.
You're doing better. Okay, so
Yeah.
what I'm going to do is I'm just going to show how I analyze the motion of your spine,
Okay.
and we'll do a treatment and go from there.
Sounds
Okay?
good.
So when we analyze the spine, the first thing I do is I always look at the posture. I look to see how the occiput or the skull, and you could look at the ears to see if someone's tilted, if one side is up higher than the other, and that tells us where the muscle spasm is. You didn't know I was looking at your posture, did you?
No.
No, but I'm always doing that.
Am I crooked?
No, you're actually better than when you first came in. When you first came in, though, actually, the left side, let me look here. Yeah, the left side was really cramped down, which means there was a lot of muscular spasm on this side. So I look at the posture, look at the shoulders, make sure nothing strikes me as weird. And then I go right on top of the spine. And you mentioned that it is your little finger.
Yes.
Where you were
my
noticing
pinky.
the pinky.
Mm-hmm.
And so that usually is down lower, so we're going to focus lower there. And the first thing I do is I use what's called static palpation, which means you're not moving at all. That means static. And then I'm using my fingers, and I just run my fingers up the spine. And what I'm doing is I'm looking for any area where the tissue above the spine has an excessive amount of tension, and that usually indicates that there's been an injury or damage to that area. So when I do this, for example, is it tender right there?
Mm-hmm.
Okay. So isn't that weird
Mm-hmm.
that I can feel that? So it's tender there. Now it's not tender there, is it?
No.
No. Okay. So right here is normal, right here is not. So now what I'm going to do is I'm just going to see how your spine moves, because normally the vertebrae should move in 6 different directions. So what I'm going to do is I'm going to go backwards and forwards, and what I'm doing is I'm looking for the spine to see if it will go backwards and forwards normally, and it appears to be doing that normally. So then I'm going to go side to side. I'm going to put my finger on this side, bend to the right, and then I'm going to go to this side and bend to the left. Now it appears as though it doesn't really want to bend to that side. Yeah. Do you feel like there's more stiffness?
Mm-hmm.
Okay. So again, that's a clue that you feel it, and right there it bends more nicely. Then I'm going to check rotation, the ability of your spine to rotate. Now here, so it won't bend well to the right, but when you rotate to the right, it appears as though the spine actually will allow the rotation to occur, or the soft tissue will allow it. When I go to this side, it kind of sticks. It doesn't want to go as far to the left. So when we do the adjustment, what we're trying to correct is a bending to the right and a rotation to the left. And that's how we do the adjustment. And then I'm just checking the first rib here, which attaches to there. I'm just pressing down here, and seeing which one is better. Okay, so let's get started. Let's have you lie down on your back. Actually, you can put the glasses over there. Why don't people just stop? Now we'll do a public service announcement. Just watch where you're going, right?
Right? Just pay attention.
Just pay attention. My goodness. Actually, why don't you stand right there? That'd be better view. Seriously, you ruin people's lives when you hit them. It's not just an inconvenience, but you're lucky that you came out of this, okay?
Mm-hmm.
I think I mentioned before, some people get in car accidents and their lives are never the same because the injury was so bad that they don't recover real well. And so definitely it's a lesson. Don't get in car accidents, or don't cause car accidents.
Some people are really afraid of driving, sorry.
Some people are afraid of driving?
For that reason. They're scared of being in a car accident.
You mean younger people? What do you
Younger
mean?
people, older people.
Well, here's the thing. Older people have trouble with vision. As they get older, a lot of people have glaucoma, and they actually have trouble seeing. And it's an uncomfortable feeling driving and everything is blurry. You know what I mean? Younger people justifiably should be afraid of driving. It's a scary thing to be in a 10,000 pound piece of metal that can go any speed you want, you know? And so you gotta put the phone down, and you gotta, you know, the old saying, put both hands on the wheel and actually watch where you're going.
Right.
But a lot of people, they get comfortable driving and they think it's just an extension of their body, and then they get to where they're not looking. You know, kids are crying in the back seat. You know, they drop food. They're eating in the car. They're listening to music. They're on the phone. All those things are distractions, and then all of a sudden they hit you. You know, from behind. It happens. The scary thing these days now is not so much as the cell phone, but people are on prescription medication, and if you actually read what the prescription medication says, it actually says don't drive.
Right.
So it's not I'm not making a light of it or making a joke, but it is kind of funny. You go to a doctor, they give you a medication, and they say, thanks for coming in, goodbye, and they actually gave you something, and technically you're not supposed to be driving home, but people do all the time. So people's reflexes and their ability to have sensory awareness is restricted, and there's a lot of people on medications that are like that. So sometimes they can't stop quickly enough, and again, then they smack you. Okay, so what I'm doing is I'm just softening up that area. So now when I do this adjustment, what I'm going to do is have you bend to the right, and we're going to rotate it to the left, and that's how we make the correction. Okay, so I'm going to go right down below, right to there, and bend to the right, and rotate to the left. And it'll just be a quick second here. There we go. Felt that? Yeah? Okay, now go ahead and sit up for me. And then Vicky, you can go over there and face that way. So then I'm just going to recheck it here. Okay, now I'm going to press on it, okay? Is it still tender? It's better. Okay, so tenderness is a good clue that we've made a correction. Now I'm going to have it bend to the right. And it's still a little stiff, but it actually moves a little better underneath my finger. Now let's check rotation. Does it feel different? Feels better. Cool.
Doesn't feel as tight.
It doesn't feel as tight. And so, just so you know, when we correct this imbalance right here, it takes strain off the area where the nerve goes down into your hand. And that's how your hand is getting better, is because we're taking pressure off that nerve. So now we're going to do some various therapies, and we'll be all done for today, okay?
Okay.
All right, go ahead and lie down on your stomach.